artificial intelligence-enabled ECG algorithm was previously shown to identify the presence of undiagnosed paroxysmal atrial fibrillation and predict future AFib. In this study, we found that AI ECG AF score could also predict the presence of cognitive changes and cerebral infarcts in participants from a longitudinal population-based study who underwent cognitive testing and neuroimaging. My name is Erica Weil, and I'm currently completing a neuroimaging fellowship at Houston Methodist Hospital, and I previously completed my neurology residency and a vascular neurology fellowship at Mayo Clinic in Rochester, where I had the pleasure to work with a multidisciplinary group on this study entitled AI ECG for Atrial Fibrillation Identifies Cognitive Decline Risk in Cerebral Infarcts. Our article will be published in the upcoming May 2022 Mayo Clinic Proceedings. AI ECG AF probability score was calculated by analyzing normal sinus rhythm ECGs. Scores can range from 0 to 1 and represent a marker of atrial fibrillation risk. Our study showed that higher AI ECG AF probability scores were predictive of lower baseline and future decline in global cognition and attention in individuals without a known history of AFib, but we did not see the same relationship with other cognitive domains. In a dichotomized analysis in participants with ECGs showing sinus rhythm, there was also an association between a high AI ECG AF score greater than 0.5 and the presence of cerebral infarcts on MRI. The majority of these infarcts were actually subcortical rather than cortical. This AI ECG algorithm acquired during normal sinus rhythm, which identifies the presence of paroxysmal atrial fibrillation, also seems to detect other markers of non-AF cardiac disease, which share associations with small vessel cerebrovascular disease and cognitive decline. AFib-associated cognitive decline may not be entirely explained by cerebral infarctions visible on MRI alone, given that cognitive changes in our study appeared progressive and ischemic infarcts are expected to cause more of an acute cognitive decline. Additionally, the majority of infarcts were subcortical rather than cortical or cardioembolic appearing, as might be expected in the setting of AFib. Application of this AI ECG algorithm is a fast and easy way to screen individuals, not only to determine risk score for AFib, but also determine future risk of cognitive decline in infarcts. It remains unclear whether initiation of anticoagulation is an effective and safe preventative strategy in individuals with high AF scores, but without known history of atrial fibrillation or stroke. Prospective controlled studies would be necessary to determine whether a high AF score could serve as a biomarker to select patients for anticoagulation or more aggressive stroke risk factor modification to prevent cognitive impairment or cerebral infarcts. We invite you to view our article in Mayo Clinic Proceedings for further information.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.